use of laboratory test results is to assist in the diagnosis of a patient's condition. Laboratory test results also have many other significant medical use. A summary of the purpose and function of laboratory testing follows. Do you want me to read the rest too? How many do you want me to read? This whole thing?
You can go ahead and just do number 1.
Okay. Number 1, to assist in the diagnosis of pathological conditions, laboratory tests are most frequently ordered by the provider to assist in the diagnosis of pathologic conditions. Along with the health history and physical examination, laboratory tests provide the provider with essential data needed to arrive at a diagnosis and prescribe treatment. After obtaining the health history and performing the physical examination, the provider may order laboratory tests for these reasons: to confirm a clinical diagnosis. A clinical diagnosis is defined as a tentative diagnosis of a patient's condition obtained through the evaluation of health history and the physical examination without the benefits of laboratory or diagnostic tests. The patient's signs and symptoms may provide a strong clinical diagnosis of a particular condition, and the provider may order laboratory tests simply to confirm that diagnosis. For example, the patient may have the typical signs and symptoms of diabetes mellitus, which would provide the provider with a fairly certain clinical diagnosis. In this instance, an oral glucose tolerance test (OGTT) may be ordered to confirm the diagnosis and to institute therapy.
Very good. All right, thank you. You can stop right there. Jasmine, can you go ahead and read the next 2 bullet points, please, on page 542?
To assist in the differential diagnosis of a patient's condition, 2 or more diseases may have similar signs and symptoms. The provider orders laboratory tests to assist in the differential diagnosis of the patient's condition. A diagnosis of streptococcal sore throat must be made with a laboratory test to differentiate it from other pathological conditions with similar signs and symptoms, such as pharyngitis. To obtain information regarding the patient's condition when not enough concrete evidence exists to support a clinical diagnosis. The patient sometimes may have vague signs and symptoms, and laboratory tests are ordered to obtain information on what may be causing the patient's problem. For example, the patient may have nonspecific abdominal pain, and the physical examination may not yield enough information to support a clinical diagnosis. In this case, the provider may order a series of laboratory and diagnostic tests to assist in pinpointing the cause of the patient's problems.
All right, very good. Thank you. All right, ladies, so on the purpose of laboratory testing, I want you to highlight on number 1 where it says to assist in the diagnosis of pathologic conditions. On the first bullet point, I want you to highlight to confirm a clinical diagnosis. On the second bullet point, I want you to highlight the first sentence and the words streptococcal sore and pharyngitis, and then highlight the first sentence on the next bullet point. Okay, and then I want to take a look on page 541 on the table 15.1. So categories of laboratory test. So let's take a look at that. So the first category is hematology. Go ahead and highlight that. Highlight that it's the study of blood and blood-forming tissues. So this may be where we are ordering a SED rate. We're looking at the hemoglobin and the hematocrit, or hemoglobin, I'm sorry, white blood cell count, red blood cell count. Another test that could be performed is your CBC, because inside your CBC, it's going to give you the levels of your white blood cell count, your red blood cell count, hemoglobin, hematocrit. Now, for the category immunology and blood banking, I want you to highlight where it says immunology and blood banking deals with studying antigen antibody reactions to assess the presence of a substance or to determine a presence of disease. And then here we have anti-nuclear antibody. Has anybody ever heard of the test ANA? No. So an ANA is a really common test that your provider may order if you're working in a primary care doctor's office or even in rheumatology. ANA, the anti-nuclear antibody, it tests for, it's a good test for inflammation, right? So if the patient's having a lot of joint pain, maybe even some other symptoms like swelling, fever, fatigue, your provider may order this test because it's going to tell them if there's any type of inflammation in the body. And if there is any type of inflammation, then more than likely we kind of already are on the right pathway to find out what's going on. And if you look, another immunology test is the rheumatoid factor. So again, that plays in part of the immunology. Now for the blood banking, the ABO blood typing, the RH typing, and the RH antibody test. Where have we heard of the RH test? What chapter? Do you ladies remember? Anybody? You're quiet this morning.
What did you ask?
I'm gonna get close.
Where have we heard of the RH? Do you remember what chapter?
I remember seeing it.
Mm-hmm.
Was it chapter 8? No. No.
Yes,
It
that
was.
is correct. Yeah, chapter 8. So remember, if the mother if the mother is testing positive to the RH, then that patient and the child may need to have a series of treatment, right? So that's where these tests. That's where you're going to hear these tests. The mononucleosis test. Where do you think you may be drawing that? What field? Anybody have a guess?
What field? Like who would take it?
Yeah.
Phlebotomy
Well,
or
yeah,
no?
that's who would take it, but what type of doctors do you think would
Oh,
actually be ordering the test? Do you
OBGYN?
could be, yeah. Any other fields? All right. Well, when we think of the mononucleosis, what comes to mind? Does anybody know what the nickname for mononucleosis test is? Take a guess.
is mono?
It is the mono, yeah.
It
Do you
is
know what it's also referred to as?
no.
So it's also referred to as the kissing.
Oh yeah. I thought you were
Right.
talking about
So,
like medical terminology or something. Oh yeah.
oh no. Medical term is mononucleosis. So with that being said, what type of provider do you think are going to order the mononucleosis testing?
I don't know. I mean, just like a medical doctor or
Yeah. So like your pediatrician probably,
yeah.
family doctor. So that's a common test that you're probably going to be instructed to order or even draw in some cases. All right, let's take a look at chemical chemistry. So these are common chemical chemistry tests that are performed. Triglycerides, glucose, calcium, your ALT and AST, which are also known as your liver function test. For urinalysis, this is very common, very, very, very common test. All right, let's go turn to page 542. Microbiology. Okay, so in some of the chapters, we talked about where the provider may look under a microscope, right? It actually showed us images of what some illnesses, sorry guys, some illnesses look like underneath a microscope. Well, these are some of the common testing that your provider, or even some cases as a medical assistant, you may look under the microscope. You may look for these. So chlamydia, gonorrhea, pneumonia, streptococcal, tonsillitis, tuberculosis, tetanus. These are some common tests. Okay, look at cytology. Highlight where it says cytology deals with detection of the presence of abnormal cells. So there's not too many common tests on this one, right? It's just your chromosome studies and your Pap test, which we've talked about before. All right, parasitology. Anyone take a guess on what this is going to study?
Parasites?
That's right. It's in the word. Yep, parasites. So there are studies for the parasites. Now, what I want you guys to look at is look at the very last test. What does that say?
The tissue analysis?
For the parasitology. The very last commonly performed test.
Trichomoniasis?
Yep, and where have we heard that before?
Was it chapter 10?
Wasn't it in chapter 8?
Yeah, it did touch a little bit, maybe, I'm not sure if it was chapter 10, but we certainly covered it in chapter 8.
Yeah.
Yep. All right. Any questions on that? All right. Lily, can you go ahead and read 2, please?
To evaluate the patient's progress and to regulate treatment when a diagnosis has been made, laboratory testing may be performed to evaluate the patient's progress and to regulate treatment. On the basis of the laboratory results, the therapy may need to be adjusted or further treatment prescribed. The patient undergoing iron therapy for iron deficiency anemia should be complete blood count performed every month to assess the response to treatment and to ensure that the condition is improving. Another example is a patient who has had cardiac valve replaced and is taking
Warfarin.
And anti-coagulant used to inhibit blood clotting. The patient must have a prothrombin time test at regular intervals to assess the clotting ability of the blood. On the basis of the test result, the medication may need to be adjusted to ensure the dosage is at a safe level. A patient with diabetes who measures his or her blood glucose level each day to regular insulin dosage provides another example of laboratory tests used to regulate treatment.
Very good, thank you. Okay, so on number 2, you ladies are going to highlight the first sentence and the last sentence. Natalie, can you go ahead and read number 3, please, on page 543? Sabrina, can you go ahead and read number 3, please?
To establish a baseline level, on the basis of such factors as age, gender, race, and geographic location, individuals have a different normal levels within the established reference range of a particular test. In this respect, laboratory tests also can establish each patient's baseline level with which future results can be compared. The patient who is going to receive warfarin therapy should have a blood specimen drawn for a prothrombin prothrombin time test before the administration of this anticoagulant. The results serve as a baseline recording for the particular patient against which future prothrombin I can't say time test results can be compared.
All right, very good. So highlight the first sentence on number 3. So guys, prothrombin time, or your PT, right? That's the test, prothrombin time test. It's a very common test that's performed in the medical field. Okay, Talia, can you please read number 4?
Are we on page 543, correct?
Yes, number 4.
Okay. To prevent or reduce the severity of disease, laboratory tests also can help to prevent or reduce the severity of diseases through early detection of abnormal findings. Certain conditions such as high cholesterol, anemia, and diabetes are related common disorders and sometimes may exist without symptoms in the patient, especially early in the development of the diseases. Laboratory tests known as a routine test are performed on a routine basis on apparently healthy patients, usually a part of general physical examination, to assist in the early detection of disease. These are relatively easy to perform and present a minimal hazard to the patient. The most commonly used routine tests are urinalysis, CBC, and routine blood chemistries.
Very good, thank you. All right, so on number 4, you ladies are going to highlight the first sentence and highlight that as routine tests are performed on a routine basis or on apparently healthy patients, usually as part of a general physical examination to assist in the early detection of disease. All right, Alicia, go ahead and read number 5.
Another reason for a laboratory test is its requirement by state law. The statuses of most states require gonorrhea and syphilis tests to be performed on pregnant women. The purpose of these tests is to protect the mother and the fetus from harm by screening for the presence of sexually transmitted diseases.
Very good. All right. Jasmine, go ahead and read types of clinical laboratories.
The medical office may use an outside laboratory for testing, or the office may contain its own laboratory, known as a physician's office laboratory, POL, in which the medical assistant performs various tests. Most medical offices use a combination of the two to fulfill the provider's need for test results.
All right, very good. So you ladies are going to highlight the first sentence. So your provider may have a laboratory in their clinic, or you may send your test out to an outside laboratory, or you may do both. So it really just depends on your provider, on the needs that that provider needs to get the lab test done. All right, very good. Lily, can you go ahead and read physician's office laboratory?
Clinical Laboratory Improvement Amendments of 1988 consists of regulations developed in 1988 by the federal government to improve the quality of laboratory testing in the United States. In general, laboratory tests that are CLIA waived and commonly required, such as glucose determination and urinalysis, are performed in the POL. A wave test is a laboratory test that has been determined by CLIA to be a simple procedure that is easy to perform and has a low risk of erroneous test results. CLIA regulations are described in the greater detail later in this chapter. Most providers consider it too expensive in terms of equipment, supplies, and medical laboratory personnel to perform laboratory tests that are any more complex than wave tests in the medical office. These tests are usually performed at an outside laboratory. Outside laboratories are highly sophisticated automated equipment to perform the tests, providing the medical office with fast and reliable test results.
Very good, thank you. Okay, so I want you to highlight that the Clinical Laboratory Improvement Amendments of 1988, CLIA. Also highlight the words where it says CLIA waived, and the words glucose determination and urinalysis are performed in the POL. Highlight a wave test in the laboratory test that has been determined by CLIA to be a simple procedure that is easy to perform and has a low risk of erroneous test results. Okay, let's see. Natalie, can you hear me?
Yes, ma'am.
Okay, can you go ahead and read the components of the physician's office laboratory, the physical structure?
Physical structure of the pole should meet certain requirements to provide a safe and effective working environment for performing laboratory tests and storing laboratory equipment and supplies. The pole should work area in the medical office. Laboratory work counters should be large enough to provide ample space for testing specimens. Cabinets should be available for storing equipment and supplies. Medical assistants should check the supply inventory periodically and reorder supplies as needed.
Very good. All right, Sabrina, go ahead and read refrigerator, please.
A refrigerator should be available in the POL for storing specimens that require refrigeration, such as blood tubes and urine awaiting pickup by a courier from an outside laboratory. In addition, certain testing components, such as controls and testing reagents, may require refrigeration. The temperature of a refrigerator must be maintained at 36 degrees Fahrenheit to 46 degrees Fahrenheit to retard alternations in the physical and chemical compositions of specimens and to prevent deterioration of testing components that require refrigeration. The temperature of the refrigerator should be checked at least once each day and documented in the refrigerator temperature log sheet, as specified by the Occupational Safety and Health Administration. Standard food must not be stored in the laboratory refrigerator, and a warning label must be attached to the refrigerator to alert employees to the presence of potentially infectious materials.
Very good, thank you. Okay, I want you ladies to highlight where it says the temperature of the refrigerator must be maintained at 36 degrees Fahrenheit, 2 degrees Celsius to 46 degrees Fahrenheit, 8 degrees Celsius. Also highlight that the temperature of the refrigerator should be checked at least once each day and documented on a refrigerator temperature log sheet. And highlight warning label must be attached to the refrigerator. So each clinic usually has their go-to OSHA and CLIA representative. A lot of medical assistants do fill this role, which means you're going to help the office stay on top of the OSHA guidelines and the CLIA guidelines within your office. This is one thing that, as the person that's over that, you may be in charge to make sure that daily readings are being documented on your refrigerators, on your autoclaves, on your supplies, everything that falls into the OSHA and CLIA guidelines, it may be your responsibility. All right, very good. Talia, can you go ahead and read safety measures, please?
Safety measures are an important component of the POL. Laboratory tests involves the collection and handling of specimens that may contain pathogens. In addition, many of the laboratory tests performed in medical office involve the use of hazardous chemical reagents. How do you say that?
Chemical reagents.
Reagents.
Or reagents. Some people pronounce it either way.
It is important that safety measures in the form of equipment and supplies and emergency devices are available. Devices be available and readily accessible in the POL.
All right, very good. All right, Alicia, can you go ahead and read equipment and supplies, please?
Equipment and supplies necessary to comply with the OSHA standards should be readily accessible in the POL. These supplies include hand washing facilities, alcohol-based hand rubs, gloves, safety goggles and masks, safety engineered syringes and needles, and biohazard sharp containers and biohazard trash bags. Refer to Chapter 2 to review the OSHA bloodborne pathogen standard.
All right, very good. Jasmine, go ahead and read the emergency eye wash station.
It is recommended that an emergency eye wash station be located in the POL in the event of an accidental exposure incident to the eyes. An emergency eye wash station is a device used to flush the eyes with tepid water between 60 degrees Fahrenheit and 100 degrees Fahrenheit when dust, irritants, other potentially infectious materials, or hazardous chemicals enter the eye. The eye wash station flushes both eyes simultaneously with water at a velocity low enough not to injure the eyes of the user. Once activated, the eye wash station remains operational without requiring the use of the user's hands until it is manually turned on. The eye wash station should be easily accessible and located within a 10-second walking distance, approximately 55 feet of the hazard. The first 10 to 15 seconds after exposure of the eye to a hazardous substance are critical, especially if a corrosive chemical is involved. A damaged delay in treatment could result in permanent damage to the eye.
All right, very good, thank you. All right, Lily, will you go ahead and read procedure of operating an emergency eye wash station and read 1, 2, and 3, please?
The medical assistant should be trained in the proper operation of an eye wash station at his or her medical office. A general procedure for the operation of an eye wash station is outlined here. 1. Immediately proceed to the emergency eye wash station after the eyes come in contact with a hazardous substance. Ask for assistance if needed. 2. Activate the eye wash station using the activation lever. The protective covers will come off the nozzle head automatically and water will begin to flow out the nozzles. 3. Hold both eyelids apart with your thumbs and forefingers to keep the eyes open. Most individuals respond to foreign substances in the eyes by closing their eyes tightly. Therefore, it is important to forcibly hold the eyes open.
Very good, thank you. Natalie, can you read 4, 5, and 6, please?
Direct the flow of water at an angle to the eyes from the outside edge of the lower eye toward the inside of the eye. Do not pour directly into the eyes to prevent injury to the cornea. If necessary, remove contact lenses to prevent the hazardous substance from becoming trapped under the lens. In most cases, however, contact lenses are flushed out of the eyes by the water flow and do not need to be removed manually. Oh,
Yes, please.
you
It's
need to
okay.
hold the eyelids apart and gently roll your eyeballs from left to right and up and down to make sure the water is reaching all areas of the eyes. Isn't that scary, miss?
Um, it's it's not, because at that moment in time, what's really scary is that you've got a hazardous chemical in your eye. So your body kind of naturally, you getting that, your adrenaline is going. So it at that
Oh,
moment, it's not really scary. What you can do,
I mean, like how fast the water's coming out, because I remember the one that I had in school, the water would like shoot out really hard. Like it would even hurt it shoot out really hard.
yeah, I mean, it does come out at a pretty good force. But I mean, again, at that moment, if you're having to use it, I don't want to lose my eyesight. I don't want to lose my eyeball. So, you kind of, at that moment, you like, if you're thinking about it now, yeah, it's probably pretty scary. But when you're in that moment, you're not thinking about that. You're thinking about how I need to save my vision, right? The one thing that you
Oh,
can do at home is, even in your bathroom sink, you can kind of cup your hands with the water and put your face down into it and open and close your eyes just so you can kind of get the feeling of what it is to have the water kind of flush out your eyes. But see the difference after you do that. Like it lubricates your eyes. It actually makes your eyes feel really good, especially if you're having issues with allergies and dry eyes. So that's something that you can kind of practice. Just kind of even getting the motion of, having to hold your eyes and kind of lean over. You can kind of walk through the steps. So it does help
Okay,
a little bit.
because I get really scared with the eye droplets because my eyes get dry really fast, and then you just see the drop coming at you. You want to close your eyes.
Oh yeah, no, I can't. I mean, I just I have to, like, for me, because I'm the same way. Like, it's something that that's why I don't do contacts, because I don't like anything touching my eyes. But if I'm going to install eye drops, I'll turn my head to the side. So like if I'm going to put it on my left eye, and I'll put the drop in the corner and then blink, and then it ends up kind of going to the inside to the eye. And that's the way I've kind of learned to do it, because I can't do this. It just, I can't do it. But
How much better?
well, I mean, but the difference, like if you're having to use an eye wash station, you're not having to do this, you're doing this. So
Yeah.
it's a little different, but I'm not saying it's not scary. It's just at that moment, I mean, if you're having to use an eye wash station, then you've got bigger matters on your hand, and your body responds to that. Like it needs to get that substance out. So your body's going to help you overcome some of those anxieties.
Thank you.
You're welcome. Sabrina, can you read 7, 8, and 9, 10, please?
Continue flushing for a full 15 minutes. Return the activation lever or paddle to its resting position to turn off the flow of water. Seek medical attention to determine if further treatment is required. Clean, disinfect, rinse, and completely dry the eye wash device.
Very good, thank you. Talia, will you please read procedure for inspecting and activating an eye wash station?
It is important that the medical assistant inspects and activate the eye wash station each week to ensure that it is operating properly and to flush out the water supply line. A more detailed inspection and activation should be performed on an annual basis by a qualified eye wash service technician. The procedure for performing a weekly wash check is outlined here.
All right, go ahead and read 1 and 2.
Okay. One, make sure the access routine to the outwash station is lit and free of obstructions. Two, make sure the outwash station is well lit and the area around the outwash station is free of clutter to avoid unnecessary delay in activation the outwash station.
Very good. Okay, I want you ladies to highlight where it says the procedure for performing a weekly eye wash check is outlined here. All right, Alicia, can you go ahead and read 3, 4, and 5?
Make sure the protective nozzle covers are in place and in good condition. The cover protects the nozzle head from airborne contaminants. Make sure the eye wash bowl is clean and free of debris. Activate the eye wash device using the activation lever or paddle. The water flow from the nozzle should occur in 1 second or less following activation of the eye wash.
Thank you. Jasmine, please read 6, 7, and 8.
Make sure the protective nozzle covers come off automatically when the eye wash device is activated. Activate the eye wash station for at least 3 minutes to flush out sediment, debris, or bacteria from the water supply line. Make sure the water flows continuously once activated without the use of the hand.
Lily, will you go ahead and read the next 3, please?
Make sure that the nozzle heads are not clogged and that the water flows equally through both nozzle heads. Return the activation lever or paddle to its resting position to turn off the flow of the water. Clean, disinfect, rinse, and completely dry the eye wash device, including the nozzle heads and protective covers.
Good. Natalie, can you go ahead and read the last three?
Place the nozzle covers on the nozzle. Report any problems to the appropriate personnel. Document entered on either an eye wash inspection log sheet or an eye wash inspection tag that is attached to the device. Figure 15.4.
Very good, thank you. Room temperature and lighting. The temperature of the room should be maintained within a range that is conducive to performing a laboratory test and storing testing materials that require room temperature storage. Temperatures outside of this range can cause deterioration of testing materials such as controls and testing reagents. Some automated analyzers are able to operate only within a specific temperature range. When a specimen is tested, a chemical reaction occurs between the specimen and the testing reagents to produce the test results. With some analyzers, the chemical reaction can occur only within a certain temperature range. If the temperature is outside of the required range, the analyzer cannot perform the test, resulting in an error message that appears on the screen of the analyzer. The temperature range required for the storage of testing materials and performing tests is stated in the instructions accompanying them. Highlight that sentence. It is usually a room temperature that falls between 59 degrees Fahrenheit, 15 degrees Celsius, and 86 degrees Fahrenheit, 30 degrees Celsius. Highlight that sentence. Adequate lighting is essential to assist in the proper collection, handling, and testing of specimens. Good lighting is also needed for the proper interpretation of test results that use a visual color comparison method to determine test results, such as dipstick method of urinalysis. All right, maintenance. The medical assistant is responsible for making sure that the POL is clean and free of clutter. Biohazard sharp containers and trash bags should be replaced as needed. A disinfectant should be readily available for disinfecting the laboratory work counters each day. The medical assistant should know how to care for each piece of laboratory equipment. This information is indicated in the operating manual that accompanies the equipment. Sabrina, will you please read outside laboratories?
Outside laboratories include hospital and privately owned independent laboratories, which employ individuals specifically trained in clinical laboratory techniques and methods such as medical laboratory technologists and technicians. Because the medical assistant usually works closely with an outside laboratory, a basic knowledge of the relationship between the medical office and the outside laboratory, as described in this section, is important. If the specimen is collected at the medical office, the laboratory usually provides the medical office with the supplies and forms necessary to collect the specimen and prepare for transport to the laboratory. The medical assistant is responsible for checking these supplies periodically and recording them from the laboratory as needed.
Very good, thank you. All right, Talia, can you read the first paragraph for the laboratory directory, please?
The outside laboratory provides the medical office with a laboratory directory, figure 15.8, which serves as a valuable reference source for the proper collection and handling of specimens from transport to the outside laboratory. The laboratory may also maintain a website that includes a test menu of the specimens collecting and handling required for each test performed by that laboratory. This allows the medical assistant to access this information easily and quickly using one or more of the following: a search box, an alphabetical index, or a drop-down list. If after referring to the laboratory directory or laboratory website, the medical assistant has a question regarding any aspects of the collection and handling of the specimen that is not clear, the laboratory should be contacted before he or she proceeds.
Very good. Laboratory directories vary in organization depending on the laboratory. The following information is typically included in the directory and on the laboratory website for each test performed by the laboratory. Go ahead and highlight each of these bullet points. Name and current procedure terminology, the CPT code of the test, the reference range, amount and type of specimen required, supplies necessary for collection of the specimen, for example, which blood tubes to use, techniques to be used for collection of the specimen, special instructions, patient preparation, proper handling and storage of the specimen, instructions for transporting the specimen, causes for rejection of the specimen by the laboratory, use and limitations of the test, methodology used to perform the test. Table 15.2 is a modified table of representative tests included in a laboratory directory to provide an overall understanding of the information included in a laboratory directory. The information presented in this modified directory includes all of the categories listed previously, with the exception of the following: special instructions, instructions for transporting the specimen, uses and limitations of the test, and methodology used to perform the test. Note, refer to figure 15.11 presented later for an example of a laboratory test exactly as it's presented in a laboratory directory. All right, so let's go and take a look on page 456 and 457 on table 15.2. So each office, just like in your office or even if you're in a lab, you're going to find your PDR, which is what, ladies?
The physician's desk reference.
Very good. And then you're going to also find your laboratory directory. Now, if you are working in a POL, and then you may have multiple laboratory directories, okay? Because Quest Laboratory will be different from a LabCorp laboratory directory. And you may also have other outside laboratory directories if your office does use those resources. But this is typically what you're going to find inside that laboratory directory. Okay, so let's take a look. Let's see. Go ahead and take a look on 456. So we have our ALT and our AST. Now remember I told you those are common tests that we perform for liver function test. So the directory tells us our CPT code, how much of the specimen needs to be in the container, and what kind of container the specimen needs to go in. For both of these tests, it needs to go into an SST or a transfer tube. Now, later in chapter 17 and 18, we're going to go further into the names of the tubes. All right, now on page 547, let's look at the CBC with differential. Jasmine, what kind of tube and how much of specimen do we need to have?
For which one?
For the CBC with differential.
Lavender top tube.
And how much do we need?
5 milliliters.
Very good. What is the CPT code for that test?
$850.
850.25, that's right. Now, you have to remember that you're going to come across having to recognize CPT codes and ICD-10 codes. Okay, and the way I want you to remember is CPT, that is our procedure codes, right? That's the action that we're doing to confirm the diagnosis. Our ICD-10 codes, those are our diagnosis codes. So you are going to have to become familiar with finding the codes and knowing what is the CPT and what is an ICD-10 code. All right, so this is just commonly some of the common things that you're going to find in your laboratory directory. But like I said, remember, you can't use your Quest laboratory directory for all patients. you have to make sure that you look up the right tests in that right laboratory directory. And we'll go a little further into that here in just a little bit. Okay, Talia, can you go ahead and read collection and testing categories, please?
Collecting and testing of a specimen can be categorized as the following. 1. The specimen is collected and tested at the medical office. 2. The specimen is collected at the medical office and transferred to an outside laboratory for testing. 3. The patient is given a laboratory request to have these specimens collected and tested at an outside laboratory. The medical assistant's responsibility depends on which of the methods is used in the medical office. For example, a specimen collected at the medical office and transferred to an outside laboratory for testing involves a series of individual steps different from the steps followed when it is collected and tested at the medical office. The following clinical laboratory methods are represented in the remainder of the chapter to provide the students with the information needed to function completely in all three modes that's described. 1. Completing laboratory request forms, reviewing laboratory reports. 2. Informing the patients of any necessary advanced preparation of the special instructions. 3. Collecting, handling, and transporting specimens. 4. Performing LIA wave tests in the medical office. 5. Practicing quality control and laboratory safety.
Very good, thank you. All right, Alicia, can you go ahead and read the purpose for laboratory requests, please?
A laboratory request is a printed form that contains a list of the most frequently ordered laboratory tests. Figure 15.6. A laboratory request is required when the specimen is collected at the medical office and transferred to an outside laboratory for testing, or when the specimen is to be collected and tested at an outside laboratory, in which case the request is given to the patient at the medical office to take to the laboratory. The request provides the outside laboratory with essential information necessary for accurate testing, reporting of results, and billing. Organized formats for the request forms vary depending on the laboratory. In general, most outside laboratories find it more convenient and economical to provide the medical office with one form for designating all tests, with the possible exception of the Pap test, in which case a separate form known as a cytology request is provided.
Very good. Okay, so how many of you have experienced having to go to an outside laboratory, right? How many have had to have the form handed to you and then you have to find that laboratory to go get tests done? I know I have several
I
times.
have.
Yeah,
Be like when you pregnant and when you have to go get your labs done, you have to walk to another room.
yes. Yep. Yep, that's right. So tell me, did your nurse or medical assistant, did they hand you just a form, or did they hand you like a form and some copies of your insurance card and driver's license, anything like that?
So they just had me one paper, and I guess they sent all the others to email or something.
That's right. So if your office is set up electronically, right, on an EMR, you may or may not have to carry anything. Some things are sent over electronic, right? So when I worked in dermatology, we had it set up with Quest and LabCorp in our EMR. So we could order tests within that correct laboratory, and the order and the patient's information and demographics were sent electronically. If your office is not on an EMR, then you may have to fill out a laboratory rec, and you may or may not make copies for the patient, or to, like you said, email them or fax them to the lab. Okay, so if you're having to manually fill out a lab requisition for your patient, I am going to instruct you to fill out every possible information on that requisition form. Okay. Now, when you get to your extern site or your medical office, they may have you do it a little differently, and that's fine. But the reason I want y'all to make sure you fill out everything, because it helps the lab, right? It prevents those calls saying, The ICD-10 code's not on here. The tests are not circled, things like that. It just prevents those calls. So let's go ahead and take a look at parts of a laboratory request form. I want you ladies to highlight number 1, number 2, 3, 4, 5, and 6. On number 6, I also want you to highlight where it says a profile, also known as a panel, consists of a combination of laboratory tests that have been determined to be the most sensitive and specific means of identifying a disease state or evaluating a particular organ or organ system. All right, so Jasmine, can you go ahead and read 1 and 2, please?
1. Provider's name and address. The provider's name and address should be clearly indicated on the laboratory request form to facilitate the reporting of test results to the provider. Laboratory request forms are usually pre-numbered with the provider's account number, which assists in identification, reporting, and billing of laboratory tests. 2. Patient's name and address. The patient's name and address must be documented on the form as requested by the laboratory. For example, a laboratory may want the patient's name designated with the last name first, middle initial, and then first name. The patient's address is needed for billing purposes and must include the city, state, and zip code.
All right, very good. So you guys have to remember these are very important that we have to make sure is on our lab requisition form, because we have to think of it as if we're sending our patient to an outside laboratory. That outside laboratory has got many patients in their office, right? A lot of them could be Karens, a lot of them could be Williams, could be Sarah's. They're common names. So as much information that we can put is going to help them identify the correct patient and drawing the correct test. All right, Lily, can you read 3 and 4, please?
Patient's age and gender. The reference ranges of some of the tests vary depending on the patient's age and gender. The reference range of hemoglobin concentration varies according to the gender. Date and time of collection of the specimen. The date of the specimen collection indicates to the laboratory that the number of days that have passed since the collection, providing the laboratory with information regarding the freshness of the specimen. A time lapse that is too long between collection and testing of the specimen may affect the accuracy of some test results. The time of the collection is insignificant with respect to certain laboratory tests. The reference range of serum corpuscle varies depending on whether the specimen is collected in the morning or in the afternoon.
Very good. Okay, so as the medical assistant, you must make sure that we do include the patient's age and gender. That's going to help the lab specialist when they send the results. They're going to make sure that the reference ranges are acceptable for that patient's age and gender. Okay. The date and time of collection of specimen, if you are drawing the test, that must be filled out. If we are sending our patient to an outside lab, you do not have to fill that out. That's going to be up to the lab technician that's drawing the test. All right, very good. Natalie, can you read 5 and 6, please? Sabrina, can you go ahead and read 5 and 6, please?
Laboratory tests desired. The tests desired by the provider are usually indicated by marking a box adjacent to those tests and their corresponding CPT codes, as illustrated in Figure 15.6. A space designated as additional test or other test is provided on the laboratory request form for specifying the CPT code of a test that is desired but not listed on the request form. As previously indicated, the laboratory request form includes only the test from most frequently ordered. The laboratory directory contains a complete listing of all tests performed by the laboratory. Profiles, laboratory tests termed profiles may be ordered by the provider. A profile, also known as a panel, consists of a combination of laboratory tests that have been determined to be the most sensitive and specific means of identifying a disease state or evaluating a particular organ or organ system. The profile is performed by an outside laboratory and the tests included in each are listed in the laboratory directory. A profile may be specific in nature, that is, all tests included relate to a specific organ of the body or a particular disease state. A specific profile is usually ordered when the provider does not have a definite clinical diagnosis but has a good idea of the patient's condition or what the organ or organs are involved in the patient's condition. The provider orders a profile of the condition or organ in question. An example of a profile used to identify a disease state or rheumatoid profile, which is used to assist in the diagnosis of rheumatoid arthritis. An example of a profile used to evaluate an organ is the hepatic function profile, which is used to assess liver function and to assist the diagnosis of a pathologic condition that affects the liver.
All right, very good. You can stop right there, dear. Thank you. Talia, can you go ahead and read the next paragraph?
A profile can also may be general in nature. A general molecular profile contains numerous routine laboratory tests and is used primarily in a routine health screen of the patient. General metabolic profiles are used to detect any changes in the body's biologic processes that may be presented, although the patient may not have any symptoms to indicate that these changes have occurred. General metabolic profiles also can be used when the patient's symptoms are so vague that the provider does not have enough concrete evidence to support a clinical diagnosis of a specific organ or disease state. An example of a general profile is the comprehensive metabolic profiles refers to Table 15.3 for a list of the tests included in this profile.
Thank you. The medical assistant should have a knowledge of the names of common profiles and the tests usually contained in each, which are listed in Table 15.3. The test contained in each profile may vary slightly from one laboratory to another. So let's go ahead and let's take a look really quick on page 549. So this is a common example of a laboratory requisition. Okay, so the very top right box, you see fax, call, or mail. It is really important that we make sure that we notify the laboratory on how they need to get in touch with us for the results, right? So you're going to fill that out. The next part is your patient's demographics, your provider's information, the patient's insurance, diagnosis, and signatures. Now, if we are sending the patient to a laboratory, the laboratory will have the patient sign if that's needed. Now, let's take a look at the bottom half. So the way that this lab rec is set up, these are actually, it's really common. It's going to look like this, right? Whether we're doing Quest or we're doing LabCorp or any other special laboratory. This is pretty common on the way it's set up. So normally your very first set of tests are going to be your profiles, which we're going to go into a little further in just a second. The next one is our hematology. And then the next one, they're going to associate in alphabetical order for all other tests. Now, I know this may sound like a crazy question, but what does it mean when it says alphabetical order?
Through Z.
One more time.
A through Z.
A through Z, that's right. The reason I say that is because you have to make sure that if If it's alphabetically, that means that you first go by the very first letter, right? From A to Z. If the first letter is the same, what do you refer to next to make sure you're looking in the alphabetical order?
Next letter.
The what?
The next letter.
The next letter. That's right. Very good. So I want to make sure everybody does understand what does it mean when it is alphabetical order. So the next test, those are all going to list in alphabetical order. Now on the right, you see microbiology. So when we collect some cultures or some samples, you can still send them to an outside laboratory. You just have to make sure that yet again, we select the appropriate test. And then the other tests are ordered. So this may be where if your doctor is ordering a specific test, but it's not located on the requisition form, at that moment, you're going to go look at that laboratory directory for that lab, find the appropriate test, and write the CPT code and the name of the test there. Okay. Now, if you look at the bottom, there's words stat, venipuncture, travel, non-lab core, verbal order, chart order, handwritten, or 24-hour TUV. What does stat mean?
Immediately.
That's right, immediately. Some doctors do order things stat. In that case, you're going to make sure that that is very well known on this requisition form. Venipuncture, at this moment, everything else generally is going to be up for the laboratory that's drawing the test to mark. But in some cases, if your doctor has a POL, you may have to mark some of these if it's appropriate to that patient. All right, now let's go ahead and take a look on page 550. Any questions so far? Okay, so laboratory profiles, table 15.3. So we kind of talked just a minute ago about a profile. Now these are very, very common for your provider to say, we're going to order a CMP for this patient. Okay, so let's look at the first one, comprehensive metabolic profile. That is also known as a CMP. Now, when we order a CMP, these are the tests that are included in that one profile, right? So this is where it's pretty cool. So we're going to get our albumin, our ALP, our ALT, AST, our calcium, our BUN, our potassium, and even our triglycerides. So this is a really common profile. The next one is an electrolyte profile. Why would we be ordering an electrolyte profile?
An electrolyte imbalance.
Yeah, maybe they're having problems with dehydration, or maybe they're on medication that kind of can go against that. Very good. All right, the next one is going to be our hepatic profile. Next one is a hepatitis profile. And then we have our lipid profile. Go ahead and highlight the lipid profile and the test included in the lipid profile. So remember the last chapter we kind of talked a little bit about cholesterol, right, in the nutrition. Well, this is a common profile that your doctor may order to monitor those levels, or even order on a routine basis. So it's going to tell us our total cholesterol, our LDL cholesterol, which is what? Is that our good or our bad?
It's bad.
Okay. Our HDL cholesterol, is that our good or our bad?
Good.
Very good. Triglycerides, our VLDL cholesterol, our total cholesterol, and our ratio. Very good. So that's really, really commonly ordered test. The next one is our prenatal profile, our renal function, our rheumatoid profile. That's another common one. And our thyroid function profile, that's another common profile. All right, very good. Any questions on that? All right, very good. Let's see, Alicia, can you go ahead and read number 7, please?
Source of the specimen. Certain tests require that the source of the specimen, example, throat, wound, ear, eye, urine, vagina, be documented on the laboratory request form. This is done for identification of the origin of the specimen for the laboratory. Because this information is not available by looking at the specimen, in many instances, the source dictates the test method used by the laboratory and evaluate the specimen for the presence of possible pathogen. The test method used to detect the presence of Streptococcus in a specimen obtained from the throat would be different from that used to detect Candida albicans in a vaginal specimen.
Very good. So that's where if you are obtaining a source from a specimen, so an example, that's going to be like our cultures. We definitely need to make sure that not only do we notate on the specimen culture itself, but also on our lab requisition form. All right, very good. Jasmine, can you go ahead and read number 8?
Provider's Clinical Diagnosis, an International Classification of Diseases 10, ICD-10 format. The clinical diagnosis assists the laboratory in correlating clinical laboratory data with the needs of the provider. In some instances, the laboratory performs further testing if one test method proves inconclusive with respect to providing the provider with the information necessary to confirm or reject the clinical diagnosis. Another function of the clinical diagnosis is to assure laboratory personnel that the test results are within the framework of the diagnosis. When the results of the test disagree with the provider's clinical diagnosis, the laboratory may repeat the test on the same or another specimen. The clinical diagnosis also alerts laboratory personnel to the possibility of the presence of a potentially dangerous pathogen, such as a hepatitis virus. In addition, this information is necessary for third-party billing by the laboratory. If the laboratory bills an insurance company for these tests, the ICD-10 code for the clinical diagnosis needs to be on the insurance form. The processing of insurance forms is facilitated by having the information at hand and not having to contact the medical office to obtain it.
Very good, thank you. All right, so for number 8, I want you to highlight where it says a clinical diagnosis assists the laboratory in correlating clinical laboratory data with the needs of the provider. Also highlight that the clinical diagnosis also alerts the laboratory personnel to the possibility of presence of a potentially dangerous pathogen, such as the hepatitis virus. So what do you think that that means, right? What do we think that the laboratory is going to do? Any ideas?
Does it just run a test on everything?
Well, it does, but if it comes back as like for this example, they use the hepatitis virus. It says that the clinical diagnosis also alerts laboratory personnel to the possibility of potential dangerous pathogen. Certain dangerous potential pathogens also have to be reported to where? Not just the doctor and the laboratory, but who else do we sometimes have to report things to as a medical assistant?
The patient? Or
Yes, that's true, but I'm looking for something else.
the pathologist?
Yeah, that's going to be kind of included to the laboratory. Let's say a patient has been diagnosed with HIV. Who does that get reported to besides the doctor, besides the lab, besides the patient?
Oh, wait, is it for like third-party billing? Like it says right here? Or I don't know. I don't know.
That's okay. So sometimes that the laboratory may report things to the local health department.
Oh,
If sometimes the laboratory will do it, or sometimes the medical office will do it. So when, let's say, a person comes back that they're positive for tuberculosis, that has to be reported to additional authorities because that patient has to be monitored, and we also have to calculate data from the patient on who they've come in contact with. So it prevents further contamination to others for some diseases, not all of them. Okay, does that make sense?
yes.
Good. So also highlight that in addition, this information is necessary for third-party billing by the laboratory, which means if there is a third party, let's say there's insurance or maybe even workman's comp, the laboratory will send over the appropriate information to them as well. All right, very good. Lily, can you go ahead and read number 9?
Medication. Certain medications may interfere with the accuracy and validity of test results. The laboratory should be notified on the request form of any medications taken by the patient.
Very good. All right, Natalie, can you go ahead and read number 10, stat? Sabrina, can you go ahead and read number 10, please?
Stat. Sometimes the provider wants the laboratory test results reported as soon as possible. In this case, stat should be clearly indicated in bold letters or appropriate stat box check on the laboratory request form. Requests that are marked stat are performed as soon as possible after receipt by laboratory, and the results are telephoned or faxed to the provider as soon as they are available. After the specimen has been collected, the completed request form must be placed by the specimen for transport to the outside laboratory. The medical assistant should realize the significance of this simple but important step. Numerous possible tests can be performed on one particular specimen, and without the request form, the laboratory does not have the information it needs to carry out the provider's orders, causing delays in completing the test and reporting results.
Very good. So just again, it's just to make sure that as a medical assistant that we are putting in as much information as possible so that way we don't prevent any further delay for these patients in the laboratory. All right, so we have our first case study number 1. 3 days ago, Hildy McNichol was given a laboratory requisition at the medical office to have blood drawn and tested at an outside medical laboratory. Hildy calls the medical office and says she is a little confused. She called the laboratory for her test results and they would not give them to her. They told her to call the medical office. She does not understand this because her blood was collected and tested at the laboratory. It would seem logical to her that they would give her the test results, especially because she is paying the laboratory to perform the test. The test results have come back with abnormal values, and the provider is at a medical convention and will not return until tomorrow. So the first part of this is kind of not really that common, but it can be. But the last part of this case study is very common. So let's start with what would you do?
I'm guessing that the laboratory won't give her the test results because the laboratory is not the ones who ordered them, the physician is. So they're the ones that have to relay that information to her.
That's right. Good. All right. What else? Anything else?
maybe we could, like, just when the lady calls, just let her know that the doctor's out and we'll be back tomorrow. But as soon as he comes, like he, I don't know what it is, but whenever they come in, they can call, like straight in the morning.
Yes. So that's good. Okay, so with the last part of this case study, it's very careful on how you say it, not so much what you say. So for some patients, especially those that are awaiting urgent results, okay? If our doctor is out of town, our patients become very easily agitated if we cannot provide them with the results when they call. Now, if your provider has not reviewed the results, we cannot give the patient the results. The provider must review them first. So if my provider is out of town, let's say he went on vacation for a week, then I am going to tell the patient that the provider is not in the office at the moment. Once the provider reviews the results, we will call the patient. If the results are very much abnormal and it is very concerning, and your patient and your provider is out of the office, more than likely your provider has assigned another provider to review some lab results, and in which case you can let that provider know. But just remember, we cannot give a patient lab results until the provider has reviewed them. Okay, what do we not want to do?
We don't want to give her the test results.
Right, yeah. Very good. All right, anything else? All right, so that's pretty much it. I mean, it's not too bad of a case study, but it's pretty common because, you know, even if we're doing with like biopsies and things like that, our patients worry. And we understand that. I mean, I feel like we would probably worry too if we were in that same position. But we have to make sure that we handle the situation as carefully as possible. So you don't ever want to say, oh, our doctor went on vacation last minute. He won't be back for another week. No, because the patient's going to become not really upset with not only the provider, but the staff too. So we just have to make sure that we keep it kind of vague, but we assure the patient that once the results are reviewed, we will call them, or even in some cases, the provider will call them. All right, any questions on that? Okay. Let's see, Talia, can you go ahead and read the laboratory reports?
Laboratory report forms are used to relay the results of laboratory tests to the provider, figure 15.7. The report is usually generated by a computer. It may consist of a pre-printed form with the test results printed in the appropriate spaces on the form by a computer, as illustrated in figure 15.7, or the entire report may be generated by the computer, figure 15.8, and may be transmitted electronically. The report includes the following information: 1, the name, address, and telephone number of the laboratory; 2, provider's name and address; 3, patient's name and age and gender; 4, patient access number; 5, date the specimen was received by the laboratory; 6, date the results that were reported by the laboratory; 7, name of the test performed; 8, results of the test; 9, reference range of each test performed.
All right, thank you. You can stop right there, dear. Thank you. Okay, so I want you ladies to highlight the first paragraph and number 4. A patient accession number or laboratory number is assigned to each specimen received by the laboratory. Its purpose is to provide positive identification of each specimen within the laboratory and to allow easy access to the patient's laboratory records should a test result need to be located again. Highlight those sentences. If the provider desires to have the laboratory test repeated, the accession number listed on the original report form must be included on the laboratory request form. So that just means that not only it's an identification purpose for the laboratory for the test that was drawn on that patient on that day. All right. Alicia, can you go ahead and read the next paragraph, please?
The reference range, right?
Yes.
Okay. The reference range is also commonly referred to as the reference interval and reference value. A reference range is defined as a certain established and acceptable parameter within the laboratory test results of a healthy individual are expected to fall. The reference range is used to interpret laboratory test results for a particular patient. A range rather than a single value is necessary for laboratory results because of the individual differences within a general population caused by factors such as age, gender, race, and geographic location. In addition, no test can be so accurate that a single value is possible. The reference range for each test varies slightly from one laboratory to another, depending on the test method, equipment, and regions used to perform tests. Because of this, it is essential that the medical assistant compare the test results with reference ranges supplied by the laboratory performing the test rather than with a reference source such as a medical laboratory test website.
Very good. I want you to highlight the words reference range and acceptable perimeter. All right, Jasmine, can you go ahead and read the next paragraph, please? Lily, can you go ahead and read the next paragraph, please?
Laboratory reports are delivered to the medical office by one or more of the following methods: faxed, mailed, hand-delivered, or by laboratory courier, or sent electronically from the laboratory computer to the medical office computer. Abnormal results that pose a threat to the patient's health and laboratory reports marked stat are telephoned or faxed to the medical office as soon as the tests have been completed. A complete written report follows immediately thereafter. The laboratory usually supplies the medical office with telephone reporting pads to transcribe results from the telephone report to reduce errors.
All right, very good. So remember, we already kind of talked about when our provider orders something stat. So in most cases, if your provider orders something stat, or even if something is very abnormal, let's say possibility of cancer for a patient, the laboratory is going to contact the provider and let them know the results. And in some cases, they're going to call and they're going to relay the results to the medical assistant. If you are the one that's taken those results, you document who you're speaking with, where they're calling from, and the results that were relayed to you. And then the lab is going to send a typed report of those results to the office, usually within, if not that day, within a couple of days. So that's pretty much when we're doing stats, that's how the lab takes care of that. So I want you guys to highlight where it says that the laboratory reports are delivered to the medical office by one or more of the following methods: faxed, mailed, hand-delivered by a laboratory carrier, or sent electronically from the laboratory computer to the medical office computer. The medical assistant may be responsible for reviewing laboratory reports as they are received. The medical assistant should compare the patient's test results with the reference ranges supplied by the laboratory and notify the provider of any abnormal test results. Most laboratory computer systems automatically flag and highlight abnormal results on a laboratory report. The provider carefully reviews each laboratory report received by the office and the data obtained and correlate with information obtained from the health history and physical examination. The provider indicates that he or she is finished with the report, usually by placing his or her signature on it. The medical assistant is then responsible for filing the laboratory report in the patient's medical record according to the medical office policy. All right, any questions on that? All right, so let's take a look real quick at figure 15.7, a laboratory report form. This is an example of results that are sent to the office. The next one we're going to look at is a little bit more common, but this kind of tells you with the tests that were drawn, it gives you the results under that name of the test and the reference range. So let's take a look at our glucose. Lily, what are the results from the glucose test?
I'm looking.
It's okay.
Is it just where it says test? Oh, no, there.
Yeah, what do the results say on that laboratory report form on page 553?
Is it just where it says glucose? Like,
Yeah, but it's giving you a number in bold black letters. What is that number?
91?
91. So those are our results.
Oh,
Okay. Now, underneath the glucose test, you see numbers 70 through 110. That is our reference range. Okay, so Lily, based on our reference range and the results, is this result normal?
the reference range?
Uh-huh.
Oh, yeah, it's normal.
That's right. It is normal. Very good. Okay, let's look at all right, let's look at our lipids. Out of the lipid results, did their lipid profile, does it show to be normal or abnormal?
It looks abnormal
Why do you say that?
ish. Because for like total, is that cholesterol?
Yes, ma'am.
It should be greater than 200.
Does that sign in front of the 200, does that mean greater than or less than?
You're right. Yeah. That's awesome.
Yeah. Yeah. So that's
Yeah.
where, that can be kind of tricky. And sometimes I have to kind of remind myself on that process. But in that particular case, it would be normal. So sometimes the reference ranges won't be like the glucose 70 to 110. It's going to kind of give you this little figure. And then you kind of have to evaluate that and see if it's normal or not.
So it is normal.
Correct.
Yeah.
In that case, it would be normal. Yeah. Very good. All right. Any questions on that form? Okay. Natalie, can you go ahead and read laboratory documents and the electronic medical record? Just read the first paragraph, please. Sabrina, can you read the first paragraph, please?
Many medical offices communicate with outside laboratories electronically using a computer system that interfaces with the computer system in the outside laboratory. This provides distinct advantages for the medical office using an electronic medical record (EMR). Laboratory requisition forms can be completed on the request form displayed on the computer screen using radio buttons, drop-down menus, and free text entry. Depending on the medical office policy, the form can then be transmitted electronically to the medical laboratory or printed out and placed with the specimen for transport to the laboratory.
Very good. You're actually going to highlight that whole paragraph on this one. All right, Talia, can you go ahead and read the next paragraph, please?
Once the patient's test has been completed and the laboratory test results are sent electronically to the medical office, the laboratory report is placed in the provider's electronic review box for his or her review and electronic signature. Abnormal values are often highlighted on the report as shown in Figure 15.8. If critical results appears on the laboratory report, an urgent message is emailed to the provider. After the provider reviews the laboratory report and places his or her electronic signature on the report is electronically filled in the patient's EMR.
Very good. Other advantages of the laboratory component of an EMR include the ability to quickly view laboratory results in chronological order. All right, guys, what does chronological order mean?
Like 1, 2, 3, right?
Mm-hmm. Yep. So chronological is our number. So it's gonna list either the latest results all the way to the oldest results, or it may, just depending on that office, it may flip it around. It'll go from first time ordered all the way to current ordered. But that's right. That's going to be our numbers. Very good. In addition, results of the laboratory test performed on a routine basis, for example, glucose testing, cholesterol testing, can be assessed by the computer and plotted on a flow sheet, figure 15.9. This permits abnormal trend to be identified early so that the appropriate action can be taken. If an EMR medical office is not networked through computers with an outside laboratory, the laboratory reports received by the office must be scanned into the computer and electronically filed in the patient's EMR. A scanned report has some limitations. The computer can display the report, but the data on the report cannot be accessed or manipulated. Because of this, laboratory data cannot be used for many of the functions previously described. For example, the data on a scanned report cannot be accessed and incorporated into a flow sheet for trend analysis. All right, so let's go and take a look at figure 15.8 on page 554. All right, so the previous report on page 553, that was a report that may be viewed if it was not electronically. This figure on page 554 is more common, right? This is going to probably be the way you're going to review your results. All right, so we have our patient's information, the demographics, the ordering physician. Remember, we talked about the accession number, the collection date, and if the patient was fasting. We have the name of the test, the value, which means the actual results, and then, of course, our reference range. And in this report, you actually see that it is also flagged, right? So it's telling us that our RBCs, which stand for what, ladies?
What's the question?
What does RBC stand for?
Red blood cells.
Very good. All right, so this patient, their red blood cell count is low. It flagged it as low. Same thing with our hemoglobin and our hematocrit. Now, if a patient is experiencing some anemia, this is pretty common. It's going to be more than one test that's reading low on the CBC. And then our RDL is actually flagging high. So this is a very common view of the way the results will be sent to you. So it is a little easier to read because they go ahead and they highlight it. But even if they didn't, the way it's set up, I think it's pretty easy to read. Like you have your results and then they provide you with the reference range and then you can determine, oh, well, that one's normal, that one's normal, that one's normal, that one's not normal. Okay. Any questions on that? All right. Talia, can you go ahead and read the first paragraph under patient preparation and instructions?
Who? You said me?
Yeah,
Okay.
go ahead and read that first paragraph under patient preparation and instructions.
Factors such as food consumption, medications, activity, and time of day affects the laboratory results of certain tests. For some laboratory results, advanced patient preparation is necessary to obtain a high-quality specimen suitable for testing, which lead to accurate results and assist the provider in the accurate diagnosis treatment. But I think I skipped something.
That's okay. Keep going.
The quality of laboratory tests test results can be only as good as the quality of the specimen obtained from the patient. A specimen obtained from a patient who has not prepared properly may invalidate the test results and necessitate to call the patients back to collect the specimen again.
All right, very good. So you're going to highlight the first sentence and the last sentence. So again, this is going to be where your laboratory directory, maybe even some of your fellow staff members and doctors will come and play until you get more of a idea on some of these tests, which basically means that if your doctor orders a lipid profile, the patient should be fasting, which means they are there to go without a period of time of food. And in most cases, the only thing they can have is water. Okay? In some cases, the patient needs to also withhold their medication. So this is just really important that until you kind of become familiar with what goes to what, make sure you lean on your laboratory director, your fellow staff members, and even your provider. Because the last thing that we want is we do not want our patient to have to repeat a lab test because of our error, right? Because that patient's going to become very easily frustrated with the office, and we do not want that to happen. All right, Alicia, can you go ahead and read the next paragraph, please?
Will you tell me what we were supposed to highlight one more time? Because I missed it. I heard you like right after, but I forgot.
That's okay, of course. It's the very first sentence and the last sentence on that paragraph.
Under the patient and preparation?
Yes, ma'am.
Okay. And then you want me to read the next one?
Yes, ma'am.
Okay. The medical assistant is usually responsible for instructing the patient about the nature of the laboratory test and any advanced preparation that might be necessary. A complete and thorough explanation of the information should be relayed to the patient. The patient should be informed of the name of the test, how to prepare for the test, how the test is performed, and how and when to expect the test results. The medical assistant should make sure to explain the reason for the advanced preparation so the patient will be more likely to comply with the preparation necessary. It should be emphasized to the patient that the preparation is essential to obtain accurate test results and to avoid having to collect the specimen again.
Very good. Thank you. Jasmine, will you read the next paragraph, please?
Where are we? I'm sorry, I should make breakfast.
On page 556, that very next paragraph where it says, after the instructions have been explained.
Okay. After the instructions have been explained, the medical assistant needs to verify that the patient completely understands them and should offer to answer any questions. It also is advisable to provide the patient with a written information sheet, figure 15.10, to serve as a reference should the patient forget some of the information after leaving the medical office. Some specimen collections may require that the patient remain at the collection site for a specified time. An example of this is the OGTT, which requires several hours for the collection of multiple time specimens. The patient should be told in advance of the time requirement so that any necessary arrangements can be made with an employer or child care provider.
All right, so let's go and take a look real quick on figure 15.10. So this is information for the oral glucose tolerance test, which means if your provider is either already planning ahead on ordering this test or are going to order this test, we can go ahead and provide the patient with the instructions that they're going to need to follow so that they're prepared and the tests are going to become more accurate and less likely are going to need to be repeated because of errors. So if our doctor orders the OGTT test, when does a patient need to start preparing for the test before the test is done?
Preparing for the test
Uh-huh.
3 days prior.
That's right. So 3 days prior. So this means that even though your doctor's ordered this test, the patient is not going to go get it done right now, right? There has to be some preparation. So this is a pretty common that you're going to follow on some of the tests that your doctor may order. Okay, any questions on that? Okay. Lily, can you go ahead and read the next paragraph, please?
Sometimes the patient collects a specimen at home. The medical assistant is responsible for explaining detailed instructions to the patient on proper techniques for collection of the specimen. For example, if at first waiting morning urine specimen is necessary for the laboratory test, the medical assistant needs to provide the patient with the appropriate specimen container and to instruct the patient on proper collection, handling, and storage of the specimen until it reaches the medical office.
Very good. Natalie, can you go ahead and read the next paragraph, please?
It said, the instruction.
No, we are on page 557, that very first paragraph where it says the specific type of preparation.
The the manufacturers the companies to or medication restriction.
Very good. All right, so we have our case study number 2. Hans Volkmann is leaving the medical office after being seen by the physician. The physician gave him a laboratory requisition for a complete blood count and a lipid profile. Hans notices the clinical diagnosis on the form indicates iron deficiency anemia and wants to know why the physician did not prescribe any medication for him if he thought he had anemia. Hans said that he told the physician his father had a heart attack at age 53 years and asked whether he would order a cholesterol test. He says the physician must have forgotten because the test was not marked on the laboratory form. Hans has been instructed to fast for the laboratory test. He says that he stops every morning at the Coffee Cup restaurant and has coffee with cream and sugar, orange juice, and 2 donuts. He would like to know whether he could just have the coffee with cream and sugar before the test. Hans says that he has a hard time functioning in the morning without coffee. All right, so my medical assistants, what would you do?
We should inform the patient that he's asking if they're doing a cholesterol test, but that's along with the lipid.
Very good.
That it's very important that he follows the rules and procedures that have instructed him for the laboratory test, because even drinking coffee could, make the test results inaccurate.
That's right. Yep, very good. All right, anybody else?
And that he sees on the diagnosis form that it says something about anemia. The doctor's not saying that he has anemia, but they're just going to have to check that just as a precaution or just to make sure.
That's right.
So that doesn't necessarily mean that he has it. They just want to check for it.
That's right. So, and a lot of times you will see this. So, for some patients' insurances, we need to provide them with diagnoses that are going to correlate why we are wanting to draw these tests. So, remember, we talked about a differential diagnosis. This could come into factor on this. So, we're just providing diagnosis that maybe the patient could have, so the insurance is going to be more apt to pay for these tests. Very good. Anything else?
We should we make sure? So he told the physician that his father had a heart attack, but did he write that on his what, I don't remember what it's called, the part on the thing that he fills out? Did he write that on there?
On the requisition?
Yeah.
Well, in the case study, it doesn't state, but you brought up a good point. So, a diagnosis of family heart disease is a diagnosis. So, that may be where, if the patient said that, we can go ahead and look and make sure that that's documented in their chart for the family history, and we can add that diagnosis to the test. Very good. Anything else? Okay, what are we not going to do?
We're not going to diagnose him with anemia.
That's right. Yeah. What else?
We're not going to tell him it's okay that he has his coffee with cream and sugar.
Yeah. Yeah. Sorry, but no. All right, very good. Anything else? All right, good job. Very good job on that one. All right, let's see. Sabrina, go ahead and read the first 2 paragraphs under fasting.
Some blood specimens require the patient to fast before collection. The composition of blood is altered by the consumption of food because digested food is absorbed into the circulatory system, changing the results of certain laboratory tests. Food intake causes blood glucose and triglyceride laboratory tests to yield falsely high results. Any individual test or profile including these tests requires the patient to fast before the specimen is collected. Fasting involves abstaining from food and fluids except water for a specified amount of time before the collection of the specimen, usually 12 to 14 hours. Fasting specimens are usually collected in the morning to allow food from the previous evening meal to be completely digested and absorbed. In addition, collection of the specimen in the morning causes the least amount of inconvenience to the patient in terms of abstaining from food and fluid.
Very good. Okay, so in the first paragraph, I want you ladies to highlight that last sentence and then highlight the first sentence in the next paragraph. All right, Talia, go ahead and read the next two paragraphs, please.
The medical assistant must give detailed instructions ensuring that the patient understands that fasting includes abstaining from food and fluids. The patient should be told, however, that it is permissible, in fact, advisable to drink water because dehydration caused by water abstinence can alter certain test results. The medical assistant should indicate a specific time to the patients for initiating of the fast. If the specimen is to be collected in the morning, the patient should be instructed to begin fasting at 6 p.m. on the previous evening. The patient also must be told the time to report for collection of the specimen.
Very good. All right, medication restrictions. So just like there may be diet restrictions, for some therapy, medications also need to be, we need to give instructions on that. Alicia, can you go ahead and read the first paragraph under medication restrictions, please?
Many medications affect the physical and chemical characteristics of body substances. Medications taken by the patient may lead to inaccurate test results. Antibiotic therapy administered before collection of a throat specimen for strep throat may cause a falsely negative test result. The provider may ask the patient to avoid taking medication for a period of time before the collection of the specimen if discontinuing the medication would not cause any health threat or serious discomfort to the patient. Because medication is more likely to interfere with test results or urine than on blood, the patient is asked to discontinue medication 48 to 72 hours before the collection of a urine specimen and 4 to 24 hours before the collection of a blood specimen.
Very good. All right, so you're going to highlight where it says that antibiotic therapy administered before collection of a throat specimen for strep testing may cause a falsely negative test result. All right, Jasmine, can you please read the next paragraph?
I'm lost again.
Medication restrictions, the second paragraph.
Okay. If the patient cannot be taken off medication, this information should be documented on the laboratory request form for specimens transported to an outside laboratory for testing. This alerts the laboratory personnel to the presence of the medication. If the medication taken by the patient interferes with the method normally used to perform the test, the laboratory may be able to use an alternative method to obtain valid results. If the test is being performed in the medical office, the medical assistant should consult the manufacturer's instructions and accompany the test for the names of medications that interfere with test results.
Very good. All right, Lily, go ahead and read that last paragraph, please.
The provider determines the need for the patient's discontinue medication before specimen collection. The medical assistant is responsible for ensuring that the patient understands any instructions regarding restrictions on medications the patient is taken to the laboratory.
All right, very good. Okay, so Let's see, Natalie, can you read the first paragraph for collecting, handling, and transporting specimens?
Laboratory tests are performed obtained from the body. A specimen is a small sample or part taken from the body to present the nature of the whole. Most laboratory tests are performed on specimens that are obtained from the body, such as blood, urine, feces, sputum, cervical and vaginal scrapings of cells, and secretions of discharge from various parts of the body. Examples: nose, throat, wound, ear, eye, vagina, urethra. More for microbiologic analysis, other examples of specimens analyzed in the laboratory but more difficult to obtain from the body include gastric juices, cerebrospinal fluid, pleural fluid, peritoneal fluid, synovial fluid, and tissue specimens for biopsy.
All right, very good. So you're going to highlight this sentence where it says, a specimen is a small sample or part taken from the body to represent the nature of the whole. All right, Sabrina, can you go ahead and finish the next two, or I'm sorry, read the next two paragraphs on page 558?
The medical assistant is responsible for the collection of most specimens obtained by the patient in the medical office. Of these, blood and urine constitute the largest percentage of specimens collected. Certain specimens, such as sample of vaginal or urethral discharge, cerebrospinal fluid, or tissue specimen, must be collected by the provider. In these cases, the medical assistant assists with the collection. The most important goal of the specimen collection is to provide the laboratory with the sample that is biologically representative as possible of the body substance collected. If the specimen is collected or handled improperly, the in vivo characteristics of the specimen may be adversely affected, which may cause inaccurate and unreliable results. This may interfere with the accurate diagnosis and treatment of the patient's condition.
Very good, thank you. All right, I want you ladies to highlight the words in vivo. All right, guidelines for specimen collection. Talia, please read number 1.
Specific guidelines that should be regarding specific specimens collected and handling following review in the following OSHA bloodborne pathogens. Standard and specimen collections. 6.2. Procedure 15.1 describes collecting a specimen for transfer to an outside laboratory.
All right, go ahead and read number 1 for me.
Review the requirements for the collection and handling of the specimen, which includes the collection supplies necessary, the type of specimens to be collected, serum, plasma, whole blood, clotted blood, urine, the amount necessary for laboratory analysis, the techniques to follow to collect the specimen and properly handle and storage of the specimen. The medical assistant must refer to the appropriate reference source to determine the collection and handling requirements for each test ordered by the provider. If the specimen is transported to an outside laboratory, this information is indicated in the laboratory directive. 15.11 shows an example of the collection and handling requirements for a, what's that? Triglycerides test exactly as presented in the laboratory directory. The collection and handling, it's called what?
Triglycerides.
Oh, triglycerides, okay. The collection and handling requirements necessary for a specimen test in the medical office are listed in the manufacturer instructions that accompany the test system. A test system is defined as a setup that includes all the test components required to perform a laboratory test, such as testing device, controls, and testing reagents.
Very good, thank you. All right, Alicia, can you go ahead and read number 2, please?
Assemble the equipment and supplies. Use only the appropriate specimen containers as specified by the laboratory director and manufacturer's instructions accompanying a test system. Substituting containers may not yield the proper type of specimen required or may affect the test results as shown by the following examples. If serum is required and a tube containing an anticoagulant is used instead of a tube without an anticoagulant, the blood separates into plasma and cells rather than serum and cells, and the wrong type of blood specimen is obtained, which necessitates obtaining another specimen from the patient. Collection of a microbiologic specimen that may contain anaerobic pathogens with supplies meant for aerobic pathogens results in death of the anaerobic pathogen. The specimen container should be sterile to prevent contamination of the specimen. Many specimens, especially microbiological ones, are adversely affected by contaminants such as extraneous microorganisms, which may affect the accuracy of the test results. The medical assistant should check each container before use to ensure it is not broken, chipped, cracked, or otherwise damaged. Damaged containers are unsuitable for specimen collection and should be discarded. Some containers, such as blood tubes, have an expiration date, figure 15.12. The medical assistant should make sure to check the expiration date on these containers to avoid using an outdated container.
Very good, thank you. Jasmine, can you please read number 3?
Label each specimen container. The medical assistant should label each tube and specimen container. An unlabeled specimen is a cause for rejection of the specimen by an outside laboratory. 2 unique identifiers should be used to label the specimen. A unique identifier is information that clearly identifies a specific patient, such as the patient's name and date of birth. A specimen can be labeled by attaching a computerized barcode label to the specimen. Laboratory instruments that do the testing are able to read the barcodes and automatically document results on a laboratory report for a particular patient using the demographic information supplied by the barcode. A specimen can also be labeled by handwriting the information on the label, which should include the patient's name and date of birth, the date and time of collection, the medical assistant's initials, and any other information required by the laboratory, such as the source of the specimen. The information should be printed legibly, and the medical assistant should be certain that the information is accurate to avoid a mix-up of specimens. The medical assistant must also complete a laboratory request form to accompany the specimen, as described earlier in this chapter. Note: the medical assistant should follow the medical office policy as to when the tubes should be labeled. Some offices prefer that the tubes be labeled before the specimen is drawn. Other offices want the tubes to be labeled after the specimen has been drawn.
All right, very good. So when you are obtaining your specimens, I am going to have label everything first because you know that the correct information is on the correct tubes. In some cases, your medical office they will have electronically set up to where you can print off labels. In which case, it would be the same thing. You go ahead and print off the labels and put it on the containers of the specimens. All right, very good. Let's see, Lily, can you go ahead and read number 4, please?
Identify the patient. Proper patient identification is essential to avoid collecting a specimen from the wrong patient by mistake. After greeting the patient, the medical assistant should ask the patient to state his or her full name and date of birth. This information should be compared with the demographic data indicated in the patient's medical. The patient should not be asked whether he or she is a certain patient. For example, the patient should not be asked, "Are you Brand Thompson?" The patient may not hear the medical assistant correctly or may not be paying attention and may answer in the affirmative even if he is not that patient. A specimen that is not identified correctly could lead to an inaccurate patient diagnosis and the wrong treatment.
Very good. So you're going to highlight where it says, after greeting the patient, the medical assistant should ask the patient to state his or her full name and date of birth. And that is exactly how I want you guys to get used to identifying your patients before you obtain your lab specimen. Mr. So-and-so, can I have you go ahead and give me your first and last name and your date of birth? All right, Natalie, can you go ahead and read number 5, please?
Determine whether the patient has prepared properly. If the patient was required to prepare before the specimen was collected, determine whether this was done properly. Improper preparation may lead to inaccurate test results. If a test that requires fasting, such as an FBG, is performed on a non-fasting specimen, the results are altered. In this case, they are falsely high. If the patient has not prepared properly, inform the provider. The provider may want the patient to prepare properly and return, or the provider may tell the medical assistant to go ahead with the collection, but to alert the laboratory to the situation by marking the information on the laboratory request. In the example just given, non-fasting specimen would be written on the request form.
I want you